Dear audience, my name is Ágoston Jánosi. The COVID-19 pandemic has greatly impacted us all. We live like we have never lived before. We have new routines, new rules, and new losses. There is an unquestionable pressure on the scientific world, which is obvious if we see the increased publication productivity. There are 2,000 publications about COVID-19 on the scientific website Medline every week. Our aim is to join this united scientific effort with a translational approach. I'm working in the Translational Pediatric Institute, and at the COVID outpatient clinic, I have weekly experience with children affected by the disease. My irreplaceable help in my work is my supervisor, Andrea Parmitsky. My mission is acquiring deeper understanding of research methods, hence increasing my knowledge in pediatric care. Let's talk about an overview. There are three perspectives that we consider remarkably important. Firstly, we examine the prevalence of asymptomatic infections for understanding the viral transmission patterns. Secondly, we investigate the effectiveness of TNF-alpha inhibitors in COVID-19 therapy. It's a new therapeutic option. And lastly, we would like to have a deeper understanding about COVID-19 by conducting an analysis of our cohort. And now let's talk about my first project. We are going to investigate the prevalence of asymptomatic COVID-19 in different pediatric age groups. The symptoms of COVID-19 are similar in children and adults, but the frequency of the symptoms varies. Children are likely to have a higher proportion of asymptomatic infection than adults, but they have a key role in the transmission. So our aim is to investigate the prevalence of asymptomatic COVID-19 in different pediatric age groups. We examine PCR-confirmed SARS-CoV-2 infection in children because our hypothesis is that the prevalence of asymptomatic COVID-19 is higher in school age, 6 to 12 years of age children, than other pediatric age groups. The clinical implication is to have the possibility to create established recommendations for protective measures, for example, school or kindergarten closure. The systematic search was conducted in 3 databases. The date of search was in the middle of October, and we also have an approved Prospero registration. There were more than 18,000 records before the duplicate removal, and currently we are in the full text selection process. Unfortunately, many patients are treated in the hospitals despite the protective measures. It is necessary to find new, effective, and safe therapeutic options for efficient treatment of COVID-19. We saw the need for a systematic review about TNF-alpha inhibitors in COVID-19. The COVID-19 Global Rheumatology Alliance Registry collected information from clinicians of patients with rheumatic disease who were diagnosed with COVID-19. Being on a treatment with anti-TNF therapy was significantly associated with lower odds of hospitalization related to COVID-19. There are a few trials now investigate the usability of TNF-alpha inhibitors in severely ill patients, and our aim is to investigate the effectiveness and safety of TNF-alpha inhibitors in COVID-19 therapy with a meta-analysis. We included studies that conducted the analysis in a population with SARS-CoV-2 infection, and we accept a population as a control group which only have standard of care without any administration of TNF-alpha inhibitors. Our hypothesis is that administration of TNF-alpha inhibitors associated with better clinical outcomes in patients with COVID-19. And we would like to reach an improvement of COVID-19 therapy. The systematic search was conducted in 3 databases. And let's talk about my third project. Characterization of COVID-19 in Hungarian children, analysis of 507 prospectively collected patients' data. Children represent approximately 16% of all COVID-19 cases. Most children have mild symptoms or no symptoms. However, some children become severely ill with the disease. They need to be hospitalized and treated in intensive care. Our aim is to create a descriptive analysis based on this unique and uniform data collection, which I would like to present on the next slide. This is a figure about the registry structure. The involvement criteria are children with suspected or confirmed SARS-CoV-2 infection. And as COVID-19 is confirmed, data from the patient is collected right away on every inpatient day. After healing from the disease, they are followed up regularly for 2 years. So this registry is capable of following patients from the first emergency room visit through all steps of healthcare. For the data collection, we use an admission form, an inpatient form, an intensive ICU form, and a follow-up form with vaccination information. And biological samples are collected constantly throughout the process. And now, due to the limitation of time, let me lead your attention to the main conclusion. Our aim is to improve the care of COVID-19 patients in 3 different steps. By meta-analyzing the prevalence of asymptomatic COVID-19, we can acquire information that will aid decision makers in applying restrictions or protective measures. We also investigate the effectiveness of TNF-alpha inhibitors in COVID-19 therapy, and we could have a deeper understanding about COVID-19 with this registry analysis. Thank you for your attention. If you have any question, I'm happy to answer. And I chose this quote from Muhammad Ali: "Don't count the days, make the days count," because every day matters which we spend with the research of COVID-19.
Congratulations, fantastic presentation. I'm just wondering the past couple of weeks whether I did not check whether this can influence the results of this kind of meta-analysis, but from the start of the COVID pandemic, there are a lot of COVID-19 variants. So here we have this new Omicron COVID-19 strain. Do you think that you can somehow analyze in your meta-analysis the effect of also the new variants, not only the Delta and Alpha and the rest that we had? And of course, the prevalence of asymptomatic COVID-19 will also differ a lot based on the country's decision during the pandemic. For example, there were countries which closed only the kindergartens. There were countries which closed only the schools. What do you think? Can you somehow manage these differences in your meta-analysis?
Yes. We could create subgroups about the variations. It's under discussion, but it's a possibility, of course.
The frequency of the COVID infection in the society, how or can influence the asymptomatic rate of children? I mean, if you are in the top, if you have a wave, probably it's a different number of asymptomatic patients. And on the other part, if there only a few cases. What is your opinion in the literature? How can the frequency affect this asymptomatic children or even adults?
Yes, we are really interested in the age distribution, age proportion, first of all. So we have the hypothesis that in school-age children there are more asymptomatic infection than in other age groups, but of course there will be another outcome or where we can see the frequency of these asymptomatic infections in the population. Now,
perhaps in the school age there is per se an elevated number of asymptomatic patients, but can it be influenced the level, even if it's higher, more higher, less higher, and so on? If the general population is more and less infected, so in the different phase of the waves, do you have any impression, or in the literature are there any data that can influence?
At this point, I can't tell you an established.
I suggest to analyze this also.
It's interesting.
Is your registry only in Heimpal, this huge number of children, 507 if I remember right? Or how many centers do you have, and are you planning to expand it in the future? Thank you.
At this time, children are from Heimpal, and this registry have a uniform data. We can compare the patient's data with adults, because in the registry there are some patients from Pécs, Székesfehérvár, Szeged, and Kiskunhalas. So the children are from Heimpal at this time.
Thank you.